Good day and welcome to Blood Donation Matters. First off, thank you very much for donating your precious gift of life, which is blood. Now, have you wondered what happens to the blood that you donate? How does it become the different types of blood products that we use in clinical practice? And that's what we are going to talk about this part. So from the donor first walks into the blood donation center, they get interviewed, and then their blood is then extracted. Then afterwards, it goes to the blood bank for processing, where it is separated into different components and where it is tested when the doctor orders for it to be transfused. Now, for this part, we're going to talk about what happens within the blood bank, how these blood components are retrieved from one unit of whole blood and how it is stored. Again, thank you for your donation of blood because one unit of whole blood that a person donates will be separated into three to four different components, potentially helping three to four other people. Once blood has been retrieved from a donor, this is what we call whole blood because it contains the different components such as red cells, such as white blood cells, platelets, and also plasma with its different proteins and coagulation factors. From this one unit of whole blood, it is then separated by refrigerated centrifugation into its different components. So one whole blood is separated into red cells. It is then separated also into plasma, which also contains some of the platelets. We call that platelet-rich plasma. And from that, we separate this platelet-rich plasma into platelet concentrates and also to fresh frozen plasma. And from fresh frozen plasma, we can further subdivide it into cryoprecipitates, cryosupernates, or from the different proteins that are also found in plasma. So again, just reiterating the schema that we have from whole blood that we get from one donor using centrifugation, we can separate it into red cells, into a bag of packed red cells, and also into platelet-rich plasma. And this platelet-rich plasma can further be subdivided into a unit of platelet concentrates, and also to fresh frozen plasma. And this fresh frozen plasma still can be divided into cryoprecipitates, cryosupernates, or we can get the coagulation factors or the different proteins such as albumin or immunoglobulins that are also found in the plasma. One unit of whole blood can either be fresh whole blood, especially if it is used within 4 hours after collecting. So, fresh whole blood would contain RBCs, plasma, coagulation factors, and platelets. However, the lifespan of fresh whole blood is only up to 4 hours because beyond that, the blood product will already spoil. It is subject to bacterial contamination since it is not stored in the refrigerator. Whole blood, on the other hand, which is commonly what one might find in a blood bank, whole blood is fresh whole blood that has already been stored after 48 hours and stored in the refrigerator. Now, whole blood, as opposed to fresh whole blood will only contain red blood cells because it has already been stored in the refrigerator. It does not contain platelets because platelets have to be stored at a different temperature and has to be agitated when it is stored. It does not contain coagulation factors because coagulation factors at this time have already been degraded, since especially the labile coagulation factors like factor 5, factor 7, factor 8 have quite short half-lives. And it would only contain plasma and their proteins and volume. So the use of whole blood really is discouraged. If you would need to use blood products, use blood components, specifically red cells, platelets, plasma as you need it, and not whole blood. Because again, remember, whole blood will not contain platelets. It does not contain coagulation factors. It will just contain red cells, and the immunogenic factors that are also found in plasma. It can be used if there is evident massive blood loss or coagulopathy, such as losing 1.5 times the blood volume within 24 hours, or can also be used in trauma or hemorrhagic shock requiring massive transfusion only when specific blood products that you need are not available or they're not enough. Packed RBCs, packed red cells, are used for acute blood losses more than 2 liters or 40% of the blood volume, or for those who have symptomatic anemia, those who have disabling angina, those who have myocardial infarctions, those with chronic heart failures, or those with chronic kidney disease. Now, packed red cells are stored in a biorefrigerator at a temperature of around 4 degrees, and they have a shelf life of 35 days. So that's why after this time, if the blood product is not used, it is already going to be discarded. Platelet concentrates, or we also call them random donor platelets, are used for different functions, such as for those with ongoing massive bleeding to maintain a platelet count more than 50,000, those undergoing massive blood transfusion protocols due to hemorrhage, those who are being treated for leukemia, those with solid tumors to maintain platelets more than 20,000, or preoperatively for those with qualitative platelet defects. Platelet concentrates or random donor platelets have to be stored at room temperature, around 20 to 25 degrees Celsius. And they must be constantly agitated. They must be always kept moving. And that's because, number one, if we store them at lower temperatures, they undergo conformational shape changes that renders them inactive. Also, platelets, if it is not agitated, it will start to form clots. So that is why they had to be stored at this temperature and must be constantly agitated. Platelets have a shelf life of only around 5 days, and it's because the lifespan of platelets is only around 5 to 7 days. And also, they are highly at risk of bacterial contamination because they are being stored at room temperature only. Fresh frozen plasma, on the other hand, is used for multiple coagulation factor deficiencies, such as those with bleeding or indisseminated intravascular coagulation, those with single coagulation factor deficiencies when there are no other blood products available, those are bleeding from warfarin and about to undergo a surgical procedure, and also during massive transfusion protocols. Now, fresh frozen plasma, as the name implies, is frozen to around negative 18 degrees Celsius, and it is to preserve the viability of the coagulation factors. Now, prior to use, fresh frozen plasma is thawed to temperature akin to body temperature before it is used. And since it is frozen, shelf life of fresh frozen plasma is up to 1 year. Cryoprecipitates, which we separate from fresh frozen plasma, is used in massive hemorrhage and trauma, also for obstetric hemorrhage. Can also be used in hemophilia A because it contains factor 8. Can also be used in von Willebrand disease because it also contains von Willebrand factor, and in dysfibrinogenemias. So cryoprecipitates are also frozen and stored at negative 18 degrees Celsius, and this is thawed prior to use. Also has a shelf life of around 1 year. Cryosupernatants or cryosupernates are used in thrombotic thrombocytopenic purpura because it does not have large multimers of von Willebrand factor, and can also be used in hemophilia B because it has factor 9. Since also a frozen product, it is stored at negative 18 degrees Celsius and is thawed prior to use. And since it is a frozen product, it also has a shelf life of around 1 year. To sum up, different blood products have different storage temperatures, different transport mechanisms, and have varying expiration dates. Which again drives the point that whole blood should really not be the preferred choice of blood product for a particular application. And again, that's because whole blood would only contain active red cells and will not contain platelets because platelets are stored at a different temperature, and it will not have have viable coagulation factors anymore because it has not been frozen. So again, to sum up, whole blood has to be stored at around 2 to 6 degrees Celsius, meaning the platelets are already gone by this time because we have already placed the blood unit at a lower temperature. If it is to be transported, you can transport it within 24 hours as long as it is maintained in that 2 to 6 degrees temperature. And the expiry of pool blood is at around 35 days, just like red cells. Because again, pool blood would only contain red cells and some of the immunogenic proteins that are still found in the plasma. So packed red cells, also stored at around 2 degrees to 6 degrees Celsius, can be transported at around within 24 hours as long as it is maintained at around 2 to 6 degrees Celsius, maintained at that temperature, and also has a lifespan of 35 days. Fresh frozen plasma, again, as the name implies, has to be frozen. It is stored in deep freeze around -20, -18 degrees Celsius, and it is thawed before it is used. So it can be transported as long as it is in the frozen state, and it has an expiry of around 1 year. um Platelet concentrates, on the other hand, has to always be agitated, and they are stored at room temperature only, around 20 to 25 degrees Celsius. Again, that's why whole blood does not contain platelets, because whole blood has already been placed in the refrigerator, and we can't let whole blood stay at room temperature because it is going to spoil. It's going to be bacterially contaminated. So platelet concentrates, again, stored at around 20 to 24 to 20, 25, 24, 25 degrees Celsius, and it has a lifespan of around 5 days. Cryoprecipitates are also frozen, no, at a temperature of around -20, -18 degrees Celsius, and can be transported also in the frozen state and has a lifespan of around 1 year. Another important issue is that when blood has been issued by the blood bank, it has to be transported immediately to the patient, and the transfusion has to be started within 30 minutes upon release from the blood bank. Otherwise, it will spoil. The blood unit must be consumed, especially for red cells. The blood unit has to be consumed within 4 hours and not more than that, because we run the risk of bacterial contamination. Other blood products such as platelets, fresh frozen plasma can be run as fast drips. So to summarize, the clinician must be aware of the indications for transfusion to be able to select the appropriate blood component to be used. Again, we stress that whole blood should not be used for transfusion because it will not contain all of the components that one might need. Each component has its own storage conditions and shelf life, which is again the reason why whole blood really will not contain all of the different coagulation factors, platelets that the patient might need. Thus, blood component treatment should be done instead of transfusing whole blood.